So I'm a clinical psychologist and the Director of Therapeutic Family Services at Parkerville. I've been with the organisation for just over about 8 years now. I started off first of all as a direct care worker, and then worked my way through different programs in the organisation. So started off in child sexual abuse programs, and then went through to managing our Mirrabooka office, and then I've been the director of all the therapeutic services at Parkerville for the last 3 years or so. So, therapeutic family services really started to develop to what it looks like now, probably about 5 to 6 years ago. I remember when I first started at Parkerville, we only had one psychologist, and it was only part time, and they were working in one of our not so main offices, and they weren't working with any of the kids in our residential programs. Since then, we've really seen the need for therapeutic services, and particularly for psychology and occupational therapy and education with children who've experienced abuse and trauma. And so we've really created a specialist team dedicated to providing services to all our programs across Parkerville. So Therapeutic Family Services today includes about 20 staff of psychologists, an occupational therapist, and educational consultants, and also within that a specialist team that does family preservation services. We provide services to children and young people in our residential programs. We also provide services to the Child Advocacy Centre, to our Armidale Family Support Network, and pretty much all other programs within Parkerville. We have locations in the metro area, so in Mirrabooka, Armidale, up at Parkerville and in Midland, and we also provide services within the Murchison and the Wheatbelt area as well. All up, the services provide specialist assessment and treatment services for children, young people and families who've experienced abuse and trauma, with the primary focus being to help the families and help the individuals improve their functioning and improve their quality of life and overcome some of the really complex impacts of trauma and abuse. We do that by providing a really holistic service, and on more of a community perspective as well, and to other professionals and organisations, we provide specialised training. Child abuse, first of all, to describe the prevalence, it's really common in the community and much more common than people would really like to notice or to admit. And the impact of child abuse on children doesn't just affect the individual, it affects their siblings and their families, and can really rock and alter the whole community and the whole school environment as well. On an individual level, a child might be impacted by trauma in terms of their social, emotional functioning. They can display a lot of behavioural difficulties, both within the home and in the school environment. Emotionally, they become easily distressed. They can have difficulties regulating their emotions. Academically at school, they'll really struggle. They may appear really inattentive to the teacher, really disruptive. Socially, they find it difficult to relate to others, relate to their peers. And then also it causes massive complications in the interpersonal relationship between a parent and a child. That's because the child's going through a lot, having experienced child abuse, but the parent's also struggling to deal with that as well and to support the child through that. So the impacts of child abuse aren't just on the individual, they really do affect the whole community and at the different levels in terms of the family and the siblings and the relationships. A lot of the times these problems can actually begin in early childhood and continue right through to adulthood. So our job at Therapeutic Family Services is to really help families and help children develop and overcome some of these complex impacts. Regardless of the program that you enter within Therapeutic Family Services, we provide a holistic assessment approach and then a targeted intervention. So regardless of whether it's an individual, whether it's a child or young person or adult, or whether it's a family unit that presents to our services, the first thing we start with is an evidence-based assessment process. We also use, where we can, occupational therapy and education consultants to supplement a psychological assessment. And from there we come up with really evidence-based targeted interventions interventions. Our primary goal of Therapeutic Family Services is to either provide directly to children and young people or teach their carers or parents how to provide them with safe and nurturing reparative experiences so they might one day hopefully overcome their experiences of trauma and abuse. We have a really large team and we're spread across both the metro and regional areas. So because of that, we have to be really, really focused on how we support one another. We have to be really careful of vicarious trauma. Every day, all day, 5 days a week, we hear the stories of children and young people and the abuse that they've experienced. This can have a massive, massive impact on our emotional well-being. As a team, we spend a lot of time doing professional development, supporting one another in phone calls, in supervision, peer supervision and consultation. We have a lot of good and some not so good self-care practices, which I think is important. There's always someone available within our team at the other end of the phone if you've had a bad day or a bad session or something you've heard has really impacted you, and I think that's very, very important. We also have a really wide depth of experience and specialisation within our team. So we've got psychologists like myself who have been practicing for 8 years and been in the organisation for about 8 years as well. And then we've got some psychologists who are brand new and just out of university. So it's really important that we have that wide range of staff to support one another and really focus on growing and developing the next generation of specialists in this area.